Good afternoon, everybody. Really warm welcome to the Children's Scrutiny Panel of Kirklees Council meeting at 2 o'clock on Thursday, the 25th of February 2021. I'm Andrew Marchington. I'm the Kirklees Councillor and I'm chair of the panel. I'm just going to ask panel members to introduce themselves briefly, and then officers will introduce themselves when they're speaking to a particular item. So just go around the panel as I can see people. Richard, you just want to introduce yourself? You're on mute. Just need to unmute, Richard. Sorry.
Apologies. Richard Smith, Kirkburton Ward Councillor and panel member.
You're on mute, Councillor Marchington.
Yeah, do you want to introduce yourself, Yusra? Say hello.
Hi, it's Councillor Yusra Hussain, Kirklees Councillor, Batley West Ward, and a panel member. Thank you.
Thank you. Tony.
Tony Bromley, Co-optee.
Yeah, Dale.
Dale O'Neill, Voluntary Co-optee.
Yeah. Paul.
Hi, Councillor Paul White, Councillor for Home Valley North and panel member.
Yeah, and we've received apologies from Linda Summers, who's another one of our co-optees. So we're on to item 2, which is the minutes of the previous meeting. Can we approve those as an accurate record of the meeting on the 14th of January? Yeah, that's fine, thank you. I think all matters arising will come up during the remainder of the meeting. Any members of the panel got an interest to declare, formal interest to declare on any items on the agenda? No, thank you. The mission of the public, all items on this agenda will be held in open session. Helen, item 5, have we received any deputations or petitions?
No, we haven't, Chair.
No, and have any members of the public asked to ask a question?
No. No,
they haven't. Right. OK. So we're on to item 7, which is one of our standing items, which is the number and age of children in care. I think Julie, you'll be leading on that item for us.
Yep. Okay. Good afternoon, everybody. I'm Julie Bragg. I'm head of corporate parenting. I have responsibility for children care service, the care leaver service, and some of the fostering service. So as you can see from my report, I think what is fair to say that in the last 12 months we have sort of maintained a steady figure in relation to the numbers of our children currently in the care of the local authority. At the end of January 2021, we had 673 children. Going back to when we looked 12 months ago at the end of February, which was obviously prior to the lockdown, our figures stood at 672. So as you can see, we've had an increase of 1. Obviously, during the year, we've had times when we've had peaks, and then we've had times where not as many children coming into the care of the local authority. Again, from the report, what we can see is that the highest percentage of our age range for children in the care of the local authority for both boys and girls is our 10 to 15-year-olds. And once again, in terms of ethnicity, our highest group of ethnicities is white British young people that are in the care, around about 72%. In terms of our children that are placed more than 20 miles from Kirklees, and I think it's fair to say a lot of work has gone on over a period of time to look at how this is managed. There's lots of work happening within our through our sufficiency project, and currently at this moment in time, of the 673 young people in the care of the local authority, we currently have 76 children that are placed more than 20 miles. And within those 76, 11 of those are children that are in supported accommodation, 16 plus. And in some situations for those young people, they make those choices, wanting to remain in the local area that they perhaps have had their care experience. And in terms of, as I say, we continue to closely monitor, we continue to be proactive in ways of looking at children and through our partners with insufficiency of how we can return children to the more local area. As I said earlier, out of our children, young people in care, we currently have 29 young people who are over the age of 16 who live within supported accommodation in preparation for their next stages to becoming adults. So in preparation for independence, preparation. And out of those 29, currently 18 live within the Kirklees area and 11 outside. We have one young person in Lancashire, and that is actually a young person that has made that decision that they wanted to stay within the local area to continue with their education and to continue with the friendship groups that they've made. And then we have another young person currently in the Liverpool area, and the reasons behind that was purely and simply for safety reasons. That young person needed to be away from the local area. So I think that's a summary of my report. So if anybody would like to ask any questions.
Yeah, thank you, Julie, for that summary. Notice that Dale's got her hand up. Are you indicating to ask questions as well, Richard? Brilliant. Right, Dale first.
When I joined this panel over 5 years ago, the number of infants under a year was in single figures. It's now in double figures for both baby girls and baby boys. What I don't know is what is the policy regarding parental contact with their infants while they are in the council's care.
Okay, so whilst proceedings are ongoing prior to any decisions made with regards to a permanent plan for children, then parents in the main will have contact with the children 5 days a week, usually supervised by the local authority and usually as part of the assessment process for courts in determining a final permanence plan for a child. Once decisions have been made around what that permanence plan may be, then that then moves us into sort of different plans and different contact arrangements for children, dependent on what the permanence plan might be. So, for example, if a young person is to remain in a foster placement, what we know through research is that higher levels of contact with birth family can at times impact on the placement stability. So if there is a plan for adoption, then contact at the end of the proceedings, there will be a reduction in contact again, because what research tells us is the higher level of contact with birth family has that potential to impact on the placement. There is always a reduction plan in place to ensure that that reduction is in the best interest of the child, and contact with children who have a plan for adoption with birth families will continue until an adoption order is made by the courts. Is there anything perhaps that I've not covered, Dale, that you would like me to expand on? Or
just one thing, please. You said that the contact will be 5 days a week. How long is the contact for? Again,
it is very much based on an individual needs basis. It can be dependent on the factors. It can be dependent on the risk factors. For young babies, usually the timescales are between 1.5 and 2 hours per day.
Thank you. Thank you.
Okay, thank you.
Thanks, Julie. Thanks, Dale. Richard.
Thank you. Hello, Julie.
Hi.
I'm more interested in the difference between Kirklees in terms of the number of children in care versus the statistical neighbours. And I don't want to appear as though this is a trick question at all. It's a very sort of honest question, really. I'm coming from a position that I would like to think that all children whose circumstances dictated that they were in care were actually placed into care, because to do something like this, something so serious, obviously there are strict criteria. So where I'm coming from really is I trust the figures, and it's all fine. I'm just wondering why there's such a difference between us in this area and our statistical neighbours. You see where I'm coming from? Because if there was a huge difference, which there sort of appears to be, almost suggesting that people not being taken into care that need to be, obviously you can turn that completely around and say it's a good news thing because more children are staying with their families, but that's not always a good thing.
No.
It looks like it's a good thing, but it could be a bad thing if inappropriate families are allowed to stay together. Do you see what I mean? And there's no way in there is a trick question. It's more of a, what's the honest reason for that, if you know?
I think it's difficult to say what the honest reason is, and I think if you look across local authorities, there can be lots of different factors that can impact in terms of within the area, in terms of the poverty, with the various factors that can be. I think what I can say from the Kirklees perspective is that there is very, very close scrutiny in terms of the children that are brought into the care of the local authority, and that scrutiny comes through our legal gateway panel, which is chaired by head of service who has oversight onto the requests, and usually the starting point of a legal process for a child. If, for example, there are no changes being made within the child protection plan, the next steps of that is what we call PLO, which is public law outline. And again, a social worker needs to present to a head of service to actually initiate that process, and that's a period of time where parents have access to solicitors, they have access to legal advice, parents are given opportunities to work with the local authority in order to make the changes that are necessary for the children to remain in their care. If that again is something that fails, and then the next steps of that is again to go back to our legal gateway panel to actually review the process of whether a child needs to be in the care of the local authority or not. So I think we have a really good system process in place to ensuring that the children that are coming into the care of the local authority are the right children. Obviously, in some situations, if something happens and it's an imminent risk to a child, something might happen really quickly, and therefore we have to bypass that process as such. But through all the stages and all the process, that's where we can confidently say that the children that are coming in are the right ones. And I appreciate it is difficult, and whether there is some further work that we can explore with our statistical neighbours of why. I mean, I know particularly the area that I live, they have an extremely low number of children in their care. And I've worked for both local authorities, and I think it's really, really difficult to actually totally pinpoint the differences. Is that helpful? Do you feel as though?
Yeah, I suppose all I was coming to, I've spotted this before and I've asked similar questions before, so I don't want to go around the same question all the time. It's clearly there is a difference. We're more in line with the UK average or the England average, as opposed to statistical neighbours, and that's okay. I'm just conscious that I didn't want this authority not to be tough enough on the situations where it needs to be tough enough. You know what I mean? The last thing I want is to see kids taken away from families, but sometimes that's the inevitable consequence of the situations that kids are in. I'm very, I'm pretty happy with the answer. It just stands out so much. That's all.
And I think it is too fair. And I've worked in Kirklees for 12 years now. And prior to our Ofsted, I think it's to be fair that we didn't have those really robust systems in place. And I think what I would say is that potentially at that time there may be children that absolutely shouldn't have been in care. And so while we've been through our improvement journey and we have put in the robustness of the oversight to make sure that it is the right children, that is where we've seen those improvements. And so, having someone that's been around for a number of years, of an experience of when we had a significantly high number of children that were in care and what was that around. So I think, the processes that we've got in place has certainly improved the situation for Kirklees. As I say, again, I'll say the words, so that we're confident that we've got the right children in our care.
Yeah. Tom, did you want to come in on that point?
Yes, thank you, Councillor Watson. Tom Brailsford, Service Director for Resources Improvement and Partnerships. It was just to echo a couple of those points that Julie was saying. Really, obviously we're closer to the national average, and I guess from our improvement journey there has been, I don't know if rebalancing is the right term, but there has, it could certainly be argued, we did have a high amount of children and young people in care at that time. I think the other factor we need to think about, and it relates, in some respects to child protection planning and other areas, that what we're doing is quality assuring our processes to make sure the right children are being stepped up and stepped down on and off child protection plans. We've also got a newly established early support offer, so whether that's having some impact in terms of us, children and families being able to have their needs met at a lower level. But as Julie says, I think if Elaine was here, she would be echoing what Julie's saying in terms of we're confident that the right children and young people are being taken into care when needed. But I also think Julie's point about maybe looking at our statistical comparators and bringing something back might be a useful way forward.
Yeah, it's just asking the question, isn't it? Why is it different? And there's a couple of historic pictures as well. Yes, it has been higher than it is at the moment. I think we're up into the 700s, but also historically it's been much lower as well. 10, 15 years ago we half the number, and there was a concern that perhaps, historically Kirklees, the numbers were low and they went up at some stage. So, and I think the point that a number of people made is we just need to make sure that when a child needs to be in care, that happens. It's and that's monitored effectively. So I think it is worth looking at the statistical neighbours, but it's prompting us to ask the question, isn't it? So we might want to do that perhaps in our planning session at the beginning of the municipal year and see how that might lead us to ask particular questions on this area in the next 12 months. Any other questions on number of age of children in care? No, brilliant. Thanks, Julie. Thanks, Tom.
Okay.
And thanks to the panel members for your questions. That's brilliant.
Thank you.
Okay. Right, we're on to item 8, which is an update on engagement of family hubs. Right. Hi, Michelle.
Hi, good afternoon.
Oh, Caroline's there as well.
Oh,
Great.
good afternoon.
Good afternoon. I'm Michelle Wheatcroft, Head of Early Support, and I've got Caroline.
Good afternoon. I'm Carol Smith. I'm one of the project managers who works in children's services.
So we're going to give you a verbal update this afternoon, but I believe that you've received the December cabinet report around the family hubs as well. So this is an update on the family hubs engagement following the presentation that we made at this panel back in October. So we've now commenced the engagement around the family hubs, and that commenced on the 4th of January, and it's due to finish at the end of this week. So the aim of that engagement was to understand whether people agree with the proposal of the family hubs and factor in any comments and recommendations, and that will then inform the proposal that we are going to take back to Cabinet, and that will be presented at the April Cabinet. So as I've just said, we still are very much still sort of in the engagement period, but we have had some themes that have come out already. So we've had sort of 3 clear themes. The first one being around communication and access, and we've already actioned some of those comments that have come back from families about accessing early support. So we've actually launched a web page on the council's website, and we've actually put a contact form on there for parents so they can sort of self-refer in, or if they've just got a question to ask. The second one was around the name of the family hubs. So we understand that there's lots of hubs in Kirklees. So we have included in the questionnaire asking people for suggestions of what the name could be. So that was quite strong. And then the third one was very much around boundaries. But for us, it's important that families can access services which local for them sort of at the right time and the right place. So that's 3 themes that's come out so far. I'm going to hand over to Carol now because she's been engaged in all the engagement meetings, haven't you?
I have indeed.
So I'm going to hand over to Carol, who'll give you a little bit more detail about what we've done.
Thanks, Michelle. Yeah, as Michelle said, we started the engagement following the agreement by Cabinet when we went in December, at the end of December last year. So it's been a period of 8 weeks. We began on the 4th of January, and as Michelle's already said, we end at the end of this week. The engagement period, the engagement was aimed at all stakeholders: publics, professionals, families, young people, voluntary organisations, and third sector. So as in terms of materials, we had a quite generic online survey that we promoted through all the Kirklees channels, and I'll go into more detail about that in a short while. We also accompanied that with an easy read engagement booklet where we tried to summarise the proposals and lay them out as simply and clearly as we could. And we also had a frequently asked questions document which we updated throughout the engagement period, which may have answered any additional questions that people may have had. So the engagement has been quite extensive. We had, as I said, we had a number of methods of engaging, especially in the current COVID times that we're living through. So we did a series of online meetings. We've currently had 31 sessions which cross key partners, staff teams, third sector organisations, volunteers and foster carers, where we've engaged with approximately 250 people through those online meetings. We've also had the online survey. We adapted the survey slightly to capture the views of young people, and we engaged with our detached youth teams and some voluntary organisations, and utilised our apprentices to do that. So we held some sessions with them, and we also engaged with families and young people who were attending our sessions that we funded through half term. We've done some direct engagement with parents and carers, obviously because we're not doing as much face to face. So we used our early support staff who were working in families' homes, and when they were doing virtual one-to-ones with families, to engage with them through the community hub coordinators, and also through some voluntary organisations who've held some sessions for us. We've engaged with schools and parents via the school hub coordinators. We've held 18 sessions with ward councillors across all 23 wards. We've attended town and parish council meetings, communicated with our local MPs. We offered 8 online public sessions. Obviously, we couldn't do those face-to-face, so we advertised those through our digital channels. The engagement was shared and promoted through the Kirklees Together social media, through Heads Up, through our local offer and through the intranet. And it was also sent to a number of staff teams and organisations, including our faith groups and through our community teams. We also printed, we didn't go down the route of printing packs due to us being in full lockdown, but we did print some leaflets with information that we sent out to our food banks and baby banks for them to put in packs to parents to advise them that the engagement was ongoing, to encourage them to take part. At last count, we'd had 158 surveys completed today and 72 of the adapted young people surveys completed. And that concludes my summary of the engagement.
Thanks, Carol. So I think you see we have, under the current circumstances, done quite a robust engagement. I think we recognise that in normal times that there would have been more opportunities, but we have done sort of a robust engagement over the past few weeks. So is there any questions?
Yeah, thank you, Michelle. Thank you, Carol. Questions or comments? Paul? Paul White.
Yes, thank you very much for that, for the report. And I can confirm that your consultation has been very broad and wide-ranging, because I've certainly attended 3 of your consultations.
Some people have heard it a few times, I must say.
In all different guises. You know, that's the thing, as a local councillor, you're ending up with fingers in lots of different pies, and it's been very good. So yeah, thanks for the consultation. It has worked very well. And I think I'm one of the ones that 3 times has said I don't like the name Hub, so I'm glad that that's been picked up. I'm afraid I haven't really got an alternative, but to me, just the word support people understand. So family support, and it is a network. It's not a single building or a single place. It's just a suggestion. One of the areas I just wanted to touch on was obviously to be successful, this model needs the early intervention, and I suppose the identification of those families that are really in stress and really in need. And I think what I wanted to touch on and ask questions about is how you actually manage to get to those families as early as possible. And I'll just give you an example, because I've dealt with a family in the last week or so, and it really highlighted the issue to me, and that I hadn't really thought about. But this particular family have clearly been in stress and need for quite a long time. And the barrier really to accessing any support has been just the pride of mum and dad to ask. And I think you know, that is clearly a common issue, that it's only until it's really late in the day that somehow somebody else asked for them, and it was somebody else in this instance that asked for them rather than them coming forward. So the question is, it's really about how there's nothing in the report suggestions how you really get into families very early, and it's dealing with that barrier of pride as much as anything, because adults, you know, as a mum or a dad, you don't want to ask, you want to think that you're capable of doing absolutely everything. And of course, what we're seeing during the pandemic is more and more families getting into very stressful situations where they need support, and it may be the schools don't pick it up or whatever it is. So it's quite a broad question. How do you manage to make the service so approachable that parents ask early rather than when it's almost too late?
Yeah, that's fine. I can answer that. So I think there's a number of things. I think one thing that we've sort of realised through sort of some of this engagement and previous engagement is that early support was very much seen as a local authority service, but actually it's not. It's much wider. It's about the early support partnership. So that includes voluntary sector organisations. It includes our health colleagues, along with the wide-ranging services that we have got within the local authority. And I think I've already said, one of the themes that's coming up is about raising the awareness of the services and what is on offer for the families, and it's having that mix of universal and targeted support. So I think once families offer, we've raised their awareness a little bit more, and you know, with both families and professionals, and they understand what is available, I'm hoping then that they've got the confidence actually to pick up the phone, have a conversation with us. But also it's about us having those services where families can access and where they're confident in accessing as well. And I think in the report it talks about the service is not just about a building. So we're looking at having 4 designated children's centres, as we've got now, as I'm not going to say hub, am I? But being that centre sort of the community. But it's not just about having access through sort of the children's centre buildings. Could have the support in, as I say, in schools, in community centres, in a whole wide range of areas, and it's about people knowing where they can access that support at the time that's right for them. So it's about the activities that we've got out there as well, but very much about raising that awareness, and that's some of the things that we're looking at as well for families. So did that answer your question, Councillor White?
Yeah, it certainly did. I think that there was just a supplemental to that, really, that, you know, as a councillor, it certainly made me aware that I needed like a number immediately to go to. You know, what's the number for early family support.
Yep.
And I think possibly all counsellors will have that, you know, it's something, an experience that they've had in the recent past. And yeah, it's the way that it can come in from anywhere. It was actually an employer that contacted me, said, I don't understand local government and support for families, but I've got an employee that really needs support. And so, but he won't ring you because you're a counsellor. that was sort of like another thing or anything like that. And I had to ring him with his permission, and that started the conversation. And I think that's going to be quite a common issue, you know, with families, say in particular in the current situation, that they won't want to contact local government, they won't want to contact a counsellor because they're just not familiar with any of that. And it's starting the conversation. How do you start the conversation? Sometimes is the most difficult barrier, isn't it, of getting there.
Absolutely is. And maybe this gives some opportunities to work with yourselves as counsellors and raise the awareness of early support as well. And I think we've already, through this engagement, started to have some of those conversations.
Definitely.
Yeah, thank you. Right, Dale.
Thank you. I've got 2 points. The first one, on page 16, it says background. The second bullet says that the proposal is to have 4 designated children's centres. Now, I appreciate that the welfare of children is the main concern of these hubs, or whatever they're going to be called. My question is, where are the children? What space, time, facilities are there to be there for them? Because if I heard that in my area there were going to be a children's centre, I would expect children to be attending it.
Absolutely, and I can't agree with you. More. So this is part of the engagement, and the survey has actually asked families what they would like to see in their local areas. Carol, can you just explain a little bit more in terms of what was included in the survey and what we're going to do with the information once it's collated?
Yeah, definitely. So we tried to keep the survey quite generic and to make sure that it could inform the final model that we want to take back to Cabinet in April. So sorry, there's a little bit of feedback. So the questions were really generic, aimed at families around what services were important to them, when they would like to access them, how they would like to access them, and what were the barriers to them not being able to access them. So, sorry, there's some feedback. So when we get the results from the survey, we'll be able to analyse those. And we did also ask for local postcodes so that we could even break that down into areas. So we can use that so we've got some data and information to know what we want to use to shape the model going forward.
And I think if I can just sort of add to that as well. So, you know, we have sort of said children's centres, and we said it's not just about a building. Those children's centres are going to be used as an administration area. There will be some services from those buildings, but actually there'll be other services used in other community facilities and as well. So it will be an integrated approach.
You're on mute, Chair.
Sorry, Dale, did you want to come back with a supplementary on that?
Yes, because my question was, where are the children? And that hasn't been answered.
Sorry, in terms, can you just explain a little bit more?
Okay. It says that these are going to be designated children's centres. My question is this a centre for children's services, or is it a centre for children? And if it's a centre for children, where are they going to be? What are they going to be doing?
Okay. Yeah. I think we're just in terms of the name children's centres, that's what the statutory duty is, and that's what they were called following sort of the Sure Start Children's Centre offer. I think this is why we're calling this piece of work Family Hubs, because it's not just about the children, it's about working with the whole family. So we want it to be an offer for the community and for the family. So there will be some services for children, sort of right through the age group. It's not just about sort of the under fives. It's very much about that 0 to 19, 25 integrated offer. But also there will be some potentially some adult learning or other courses as well for family support. But it's looking at what we can offer integratedly, not just as a local authority, but with the voluntary sector. So there may already be sort of play and stay groups or play groups in that area that we can link into. Does that answer your question? Does that help?
Well, it's getting closer. I used to work for Sure Start, so I'm very familiar.
Yeah.
Okay, I'll leave it for now. Thank you very much.
We might be something to explore a little bit more elsewhere. Fine. Okay, thanks, Michelle. Thanks, Dale. Richard.
Hi, thank you. Can you hear me now?
Yeah.
Cool. Yeah, I'm quite positive actually about this. I know we spoke before when we did the engagement. I haven't been to 3 like Paul though. I think it's probably more keen than I am if he's been to 3. However, I do believe you've got most of the right things on here. I'm a little bit sort of torn in some ways, if I'm honest. It's a shame that we've got to teach people how to be parents as much as this, if I'm honest, but we clearly have, so there we are. I do like the fact that you're focusing on things like gangs, county lines, antisocial behaviour, child sexual exploitation. These are the big issues that if they're not caught early, that's the key, isn't it? The early support. Yeah. And if they're not caught early enough, then these present really big problems for young people. So I'm pleased to see that. I'm not so bothered what you call it, it's bothered or anything else. I'm really not too precious about that. The only thing that sort of worries me a little bit about this when I've read through it is the geography. So Sothwaite Town Hall in the rural area, it's pretty much as far towards Lancashire as you can get, and it's an awfully long way from bits of Herne Valley South, Kirkburton and bits of Denbydale Ward. So I just imagine that the people that might be using these services will be expected to travel from, a long way. It's a fair old trek from bits of my ward, and I know that I'm just using Sothwaite Town Hall as an example. There are others that potentially could be near a Grangemere and things like that. But, somebody in Denbydale or Sisset, I think Sothwaite's probably the nearest, and it's probably, about 14 miles. So it costs us a small fortune to get there and take a fair amount of time. So we need to just be clear that there are people who might be an awful long way from some of these centres. I don't know whether there's much we can do to fix that, how many we've got and where they are, but it's worth thinking about. And that was all really for me.
Yeah, absolutely. Thank you for your comment. And that was actually raised in one of the engagement sessions yesterday. And I totally understand what you're saying about Slathway. And again, I've come back to what I've just said. Those are sort of the administration areas where our staff are going to be based. Yes, we will potentially run some services from there. But again, I know sort of the size of the rural area, and we'll be considering that once we have all the feedback from the engagement in. So we will be looking at that piece of work. What we are proposing to do once we have all the feedback in is have some subgroups and little working groups, and to work again with a wider group of people in terms of how we support some of the concerns that have been raised, so we can deliver services where they need to be for families.
Yeah, and it's about working with local people and local groups and professionals and counsellors in those local areas to identify what the need is and where those services could be delivered. So although Slathwaite Town Hall is the designated children's centre for the rural areas, appreciate that's a huge geographical area and it's not practical. We would never expect families to bear the cost, the time or the inconvenience of travelling there. So it'd be about delivering the services that they need or where they're accessible to those, and that's what some of the questions in the survey tried to ascertain. What would be the barriers, if it's transport, if it's cost, so it would definitely be one of the working groups in the implementation about looking at things on a more local level so that the services to meet local need.
I'm happy with that. Like I said before, I've said it. When we spoke the other week, it's most of this I'm pretty keen on it all really. And the bit I made about the avoiding criminalising young people. I made that point before, and I made it in this post. I'm not going to go on about it, but this all feeds into that. So that's I'm happy with that.
Yeah, lovely. Thank you.
Thank you.
Thanks, Richard. Thank you. Right, Yusra.
Hi, well, thanks, Michelle and Carol for that. I'm just looking at one of the diagrams in the information pack that we've been given. I'm really impressed with it because it looks at things across the lifespan from preconception right up to parenting. And that's really innovative at the minute in healthcare in general, looking at things at early years. Just out of interest in terms of early support, I'm really a big fan of that because I think when things are done in a preventative way, it often prevents. Prevention is better than the cure, as I say. In terms of the plan itself, I can see there's different aspects that this sort of family hub envisages to kind of address. Are we from what I'm seeing from this, it seems to me it's from a biopsychosocial perspective. So it addresses the biological side, the psychological side, and the social needs of a family within the community. There was something that I didn't really spot, and maybe it's just feedback from myself. I know that mental health and psychological input is a big thing, and I know that childhood trauma can often impact on someone later life, and it can affect their ability to parent well. It's not something that I'm actually seeing in this particular model here, and I'm just wondering if I've just missed it and overlooked it, or if that's something that you could consider when you're designing this on a delivery sort of practical level.
Yeah, absolutely. I'm just looking at the diagram now, and mental health actually it is a big patch, and it might not be just explicit on that diagram. So we will absolutely take that back. Yeah.
Thank you so much.
Thanks, Michelle. Thank you, Yusra. Paul White.
I was just coming back on that point about the title children's centres when we were looking at things, and I think because I've been involved in a number of the consultations, in my head I'd got quite a really good picture of the sort of model, and the fact it's more virtual than physical in terms of buildings. But I think Dale's point in particular, that there needs to be perhaps a change in title and a real emphasis that these are not children's centres. These 4 bases, they're definitely bases for staff, really. They're not for providing service for families and children per se, so that the model is very much about the services being where the families are, not actually at a physical building. So it's a use of all sorts of facilities, whether it's community buildings, the actual home itself, or schools, or wherever it might be, in order to sort of tailor something very specific to the needs of that family. So I just thought maybe in the future reports, or the reports, that the emphasis is much stronger, that that's not what they are for children's centres, and families and children might have to travel to them for things, for services or whatever.
I think that, as Michelle's already said about the communication and about maybe the branding and the naming of things, I think that is definitely a key element of the work going forward, that we need to get that out so that message is really clear to families, that there's absolutely no expectation. There might be something in that, but it's not the only thing that's going on, and that we want things to be delivered not just by us, but like I said, across a partnership, in areas that are convenient and local to families where they need them.
Yeah, so if a family just live local to one of those children's centres, then by all means the access will be there for them, but families will not be expected to travel into those 4 centres.
Yeah. We do have other buildings that we'll be hoping to utilise as well, and as well as community buildings and a variety of other spaces to deliver services.
Thank you. Okay, Dale, do you want to come back in again?
Thank you, Andrew. What I was wondering is this: when the engagement process is finished and you're moving towards implementation and operation, would it be possible to provide a narrative so that we can understand what it would be like to be a young parent family with 2 children, both working, and how and when we will be able to access all the offers that are available?
Yes, certainly we can have a look at that. I think that would be really useful.
Yeah, I think it gives some examples and give people a real idea of how it could relate to them. So yeah, really good idea. Could do that.
Yeah, great. Thank you. Right, thank you. Any other questions or comments on that? Right. Thank you very much, Michelle and Carol, for the update on the work for family hubs. I know number of us as councillors are engaging that ward level. And let's look. Oh, Dale, you want to come in? Sorry, Dale. Is that hand up again? No. Okay.
Yes.
Oh, sorry. Yeah. Go on.
I was very interested in, on page 18, to learn about the WhatsApp that was used to hold virtual visits with families. I thought that was a splendid idea, but I'd like to know how much, how involved have children been in this WhatsApp visit?
Okay, can I take that away and bring that back to you? Is that okay? Can I get a response back to you?
Yes, please. Yes, please.
Okay.
Because as everybody knows, the voice of the child is something I am particularly concerned about.
Yeah,
that's fine. I can do that. Thank you.
Yeah, and it's a key part of our work programme as well. We just, we need to make sure wherever we're not talking about children, we're talking with children and asking about getting them to shape the services that they are the primary receivers of as well. So that's great. Definitely. So thank you, Michelle. Thank you, Carol. Thank you, panel members, for your comments and your questions. That's great.
Thank you.
Okay, all the best.
Thank you very much. Bye-bye.
Yeah, thank you. Bye. Right, we're on to item 9, which is the Children's Scrutiny Panel Work Programme. I think as I say, we slotted an extra meeting. There was some the educational outcomes information we were looking for. We weren't quite in a position to get a report for this meeting. Again, that links in with some of what we were talking about in terms of length of time to produce that. So we're hopefully going to have something on the 9th of April with Joanne and Emma leading on that. There is a recognition, obviously, we've had announcements today about the, again, how children, young people at 16 plus are going to be examined again this year. Hopefully that's going to be done much better, but we do need to keep an eye on the impact of that in the short term and the medium term and long term on children and young people in Kirklees. And I think some of the work that Emma introduced us to last January now, that framework for assessing progress and educational outcomes, is going to really stand us in good stead over the year ahead. Okay. As regards the the other things, the work of the program, I have picked up on my chair's briefing with Elaine and Mel about the opportunity for us to actually do some visits to I think there's been one or two missed opportunities, things we could have been observing, particularly in a virtual environment, just to corroborate some of the information we're getting at panel. So I think we've got some of those coming up, so panel members might be asked to do that as well. Dale, you got a hand indicating?
Yeah, yes. What I would like to say is that there are some things that began at the beginning of the improvement journey that we have heard nothing of for, in my opinion, too long. So I suggest that when we look at the work programme, we have a look at what we should look back at, as well as what we should be looking forward to.
Yeah, and I know you'd mentioned a couple of things, one of which I was aware of, the issue about multi-systemic therapies, which is a significant investment in.
Yes, I'm very concerned that that was a very expensive innovation. We need to know how many families have received the treatment from the therapy, how successful it has been, and how cost effective it has been and is at the moment, as I know that we're just in the process of employing at least two more professionals into that team.
Yeah. So I think, Helen, if you could make a note of that particular issue, as I say, hopefully at the June meeting, we're going to, when we have a really good look at the work programme and how we're going to work in the year ahead, that would be really useful. Tom, you got your, I don't necessarily need a feedback on the multi-systemic therapy now, but just, yeah, that's fine. So I appreciate that. I think the other thing that's come up is about liquid logic. I've been quite impressed. Some of the briefings I've been to, I know Elaine quite regularly refers to Tableau, which I understand is a way of accessing information on a daily basis, real live information. So I've been impressed. But again, that was a significant investment change that the council made in how it assessed and managed information around children and young people. So I think at some stage we could just see how if that project's been brought to completion or how it's being used at the moment. We could do that at the pinning that in as well. So so I think hopefully members, I don't know if it'd be this municipal year because we've got a bit, but if you get an email, been an invitation to come, if you can make it to one, just attend a meeting, that'd be really useful. And we're there as observers, so we need to resist the temptation to, we want to ask questions about it, but just to observe what's happening and to corroborate some of the information. And we had a couple, the one that was most useful in that respect last year, the youth offending team meeting there. It was a multi-agency meeting. A number of us went to that. We could see partnership working taking place. And I think we had a visit to Northorpe Hall as well. I think the other thing that we have put in the work programme, which is about children and young people's voice, and I know I'm thankful that Dale keeps reminding us about that. And perhaps there's some revisiting we can do, perhaps on an annual basis, at least on an annual basis. We need to be meeting sort of some of our looked after children. I know that used to happen. It's been a bit more difficult this year, but just to listen to that. And I think we've mentioned about some of the SEND work. There's an engagement, a lot of really good engagement with families and young people. That's been implemented. It'd be really good to have a follow up. Actually, the SEND report's been implemented. How does it feel now? So if we could arrange a meeting with that, and that perhaps whenever there's been a major piece of it, so that's same with the family hubs, isn't it? All this engagement work's been taking place. When there's a response to that, can we see how happy those people who engaged did the engagement are with the result of that? Dale?
The other thing that we've had is a large number of newly qualified social workers joining the council. I remember going to visit social workers after the first Ofsted report
Yeah.
And I think it's time we revisited the social workers and their teams to discover how happy they are and what they feel about the way. Do they see a professional pathway for them with our council?
Yeah, I think that, yeah, that meeting is about 5 years ago now. I know there's a really good meeting down at Riverside Court, so we can see how things have changed because children's social services aren't based there anymore. But yeah, it was really useful to talk to frontline social workers and just again to see whether how they felt about things, so we can program that in. And it'd be really useful to do that when it's. I don't know if it is easier during in the virtual world. It might be easier during the virtual world. It might be easier when we're a bit freer to go and meet people face to face again. So, any other comments or questions on the work programme? No, that's brilliant. Right, so that concludes the business of the agenda. Thank you very much, everybody, for your attendance, both officers and members of the panels, for your comments and your questions, and all the continued hard work that's been put in. Our next meeting, it's a virtual meeting, is on the 9th of April 2021. Yeah, and that's at 10:30. So our next meeting of this panel is on the 9th of April at 10:30. Thank you very much, everybody.